Hi everyone, this is lecture 3 of topic 11 cardiovascular system. We are going to learn about the effects of aging on your heart. As a person ages, the heart becomes less efficient as a pumping machine. There is increased oxygen consumption required to pump the same amount of blood. The valves have a tendency to function abnormally, and one of the most conspicuous effect is known as hypertrophy of left ventricle, which is the enlargement and thickening of the walls of your heart's main pumping chamber, the left ventricle. The causes of hypertrophy of the left ventricle are hypertension, which is high blood pressure, aortic valve stenosis, or in simple words, it's just valve problems, congenital heart disease. What would be the symptoms? It would be shortness of breath, fatigue, chest pain, dizziness. So what does this hypertrophy of left ventricle lead to? What could be the effects or complications? It could cause heart failure because heart is unable to pump enough blood to the body. It can cause arrhythmia, which is abnormal heart rhythm, atrial fibrillation, ischemic heart disease, and others. Cardiac cycle. This is an important topic, and please do not confuse this with blood circulation in the heart or the cardiac conduction system. The definition of cardiac cycle is it is events of one complete heartbeat, that is whatever is occurring in the heart between two consecutive heartbeats. And there are two main events that occur in a cardiac cycle. One is the contraction of the heart, which in scientific terms we call it as systole, and the other one is relaxation, which is diastole. So the two atria, that means the two upper chambers, they contract simultaneously. When the atria contract, we call it atrial systole. Then the atria relax. When atria relax, then the ventricles contract. We call it ventricular systole. When atria are relaxing, we call it atrial diastole. And then when ventricles relax, we call it ventricular diastole. Now let's go over the events of the cardiac cycle using the figure in the next slide. This figure shows the events of cardiac cycle. And cardiac cycle has four main events. The first event is called atrial systole. That means when the atria contract. The second event is when atria relax and ventricles contract. So it is atrial diastole plus ventricular systole. The third event is when the ventricles start relaxing. So it's early ventricular diastole. And the fourth event is when the ventricles are completely relaxed. So it's late ventricular diastole. Let's start at where it says start in the figure. So the first figure, which is A, it is atrial systole. Atrial systole is starting. That means the atria are filled with blood, and now the pressure inside the atria is higher than the pressure inside the ventricles. So blood starts flowing from the atria into the ventricles through the atrioventricular valves, because the pressure inside the atria have opened these valves, and blood flows from the two atria into the corresponding ventricles. Then the second phase begins, which is atrial diastole and ventricular systole. Now that the atria have completely emptied the blood inside them, they go into relaxation. They start relaxing. And the ventricles, because now they are filled with blood, the pressure inside the ventricles is rising. When the pressure builds up, this pressure closes the atrioventricular valves. That means the tricuspid and the bicuspid valves close. As they close, they make a sound called lub. This is the first heart sound, or S1 sound. However, the pressure inside the ventricles is still not that high to open the semilunar valves. But with the AV valves closed now, the pressure inside the ventricles is rising more, and gradually the pressure becomes so high that now the semilunar valves open. When the semilunar valves open, the blood is ejected from the ventricles into the pulmonary trunk and the aorta through the semilunar valves. The third event is early ventricular diastole. As blood is ejected out of the ventricles, now the pressure inside the ventricles drop. So the blood is now flowing back against the cusps of the semilunar valves, and these semilunar valves are now closed. As the semilunar valves closed, they make another sound called DUP, which is the second heart sound, or S2. Now blood is flowing into the relaxed atria. After this, the fourth phase is reached, which is late ventricular diastole. In this phase, all the chambers, that means all the four chambers, are relaxed and the ventricles are filling passively. After this, again it goes back to the first phase, which is atrial systole, and this entire cycle is the cardiac cycle. This slide lists some important parameters and important definitions that you have to know. The first one is stroke volume. Stroke volume is defined as the volume of blood pumped by your ventricle in one contraction. That means how much blood is pumped out per heartbeat. Usually about 70 milliliters of blood is pumped out of the left ventricle with each heartbeat. The second definition is cardiac output, or CO. Cardiac output is the amount of blood pumped by a ventricle in 1 minute. That means the cardiac output is more than the stroke volume, because the heart is going to beat multiple times per minute, right? And with every beat, it is going to pump out 70 milliliters. So how many times is the heart going to beat in a minute? That is known as heart rate, and it is typically around 75 beats per minute. So if I ask you to calculate the cardiac output based on the stroke volume and the heart rate, what would be the cardiac output? You can calculate it by multiplying the stroke volume with the heart rate. So it is 70 times 75. This is around 5,000 milliliters. So that is your cardiac output. That means your heart is pumping out about 5,000 milliliters. That means 5 liters of blood in 1 minute. So what controls the heart rate? The heart rate is increased by the sympathetic nervous system. Hope you guys remember the sympathetic nervous system is the E division: excitement, emergency, embarrassment. So when you are in a crisis or the pressure falls, that's when the heart rate is increased. In addition to the sympathetic nervous system, there are hormones such as thyroxine or epinephrine. When you exercise, it also increases your heart rate, or when the blood volume goes down. On the other hand, decreased heart rate is stimulated by the parasympathetic nervous system. Remember the D division: digestion, defecation. When you have a high blood pressure or blood volume, that also decreases heart rate, or when there is decreased amount of blood returning through the venous system. Now we are going to start the vascular system, that means the blood vessels. There are three types of blood vessels in the body. The first type are those blood vessels which carry blood away from the heart. Those are arteries, and the thinner, smaller versions of the arteries are known as arterioles. The second type are those that return blood towards the heart. So those are veins, and the smaller versions of veins are the venules. And in between these, that means the arteries or the arterioles and the veins or the venules, are very, very thin blood vessels that help in exchange between the tissues and blood, and those are known as capillaries. So there are arteries that give rise to arterioles. From arterioles, it is the capillary network, and from capillary network they start aggregating to form the venules, and the venules would merge to form the veins. Looking into the microscopic anatomy of the blood vessels, all the blood vessels, the walls of the blood vessels, they have three layers which are known as tunics. The innermost layer is called tunica interna or tunica intima, and it is made up of simple squamous epithelium. We call this the endothelium. The middle layer is the tunica media. This is made up of smooth muscles which is controlled by the sympathetic nervous system. The outermost layer is known as tunica externa or tunica adventitia. This is mainly fibrous connective tissue. This figure shows the three layers: tunica intima, tunica media, and tunica externa in the walls of the arteries and veins. There are some anatomical differences among blood vessels. When you compare arteries with veins, the arteries have a much thicker tunica media. That means the smooth muscle layer of the arteries is thicker than that of the veins. So veins have a thinner muscular layer, and that makes the lumen of the veins larger than the arteries. Now when you look at capillaries, they don't have those three tunics. They just have one layer. That layer is the tunica intima. So they are really thin-walled blood vessels which allow efficient exchange between blood and tissues. Now because the pressure of blood is lower in the veins are provided with valves. The valves prevent the backflow of blood to ensure the blood flow in one direction only. How blood moves through the vessels. In the arteries, the blood is flowing at a high pressure because the blood is pumped by the heart. So the pressure moves the blood through the arteries. In the veins, the pressure goes down. So veins use the milking action of the muscle. The milking action of the muscles is the surrounding, the adjacent skeletal muscles that are there. When the muscles contract and relax, that is known as the milking action, and this helps blood to flow through the veins. And because veins have valves provided, these valves prevent backflow of blood. Capillary beds or capillary networks consist of two types of capillaries. The first type is known as a vascular shunt or a thoroughfare channel. This is a vessel that directly connects an arteriole to a venule, while the other or the rest are the true capillaries where exchange occurs. You see the true capillaries or the capillary network where blood flows through, and these capillary networks are like residential streets, and because they are residential streets, they are provided with traffic light, and the traffic lights are the precapillary sphincters, which are smooth muscle cells, and these, whenever they are open, they allow blood to flow through true capillaries. So what happens when the sphincters are closed? Then blood flows through the vascular shunt, which is the direct connection. Major arteries of the cardiovascular system. The most important artery is the aorta. This is the largest artery and it leaves from the left ventricle of the heart. There are three regions of the aorta. As it moves out of the left ventricle, it is going up. That is the ascending aorta. Then it curves or arches to the left. That part is aortic arch. And finally, it starts going down. That is the descending aorta. When it passes through the chest or the thorax region, it's called the thoracic aorta. Then it passes through the diaphragm into the abdominopelvic cavity and becomes the abdominal aorta. So the ascending aorta gives off the coronary arteries. That means the arteries that supply the muscular wall of the heart itself. The right and the left coronary arteries come out of the ascending aorta. In the aortic arch region, three arterial branches come off from there. They are the B, C and S. B stands for brachiocephalic trunk, C stands for left common carotid artery and S stands for left subclavian artery. The brachiocephalic trunk, in turn, it would split into the right common carotid artery and the right subclavian artery. The left common carotid artery would branch into the left internal and external carotid arteries, and the left subclavian artery would split into the vertebral artery. In the axilla, that means in the armpit region, the subclavian artery becomes the axillary artery. Then it becomes the brachial artery as it is going down. The brachial artery gives rise to the radial and the ulnar arteries. This figure shows the major arteries in the human body. The major veins of the systemic circulation include the superior and the inferior vena cava. Both of these veins enter the right atrium. The superior vena cava brings deoxygenated blood from the head and the arms, while the inferior vena cava drains the lower part of the body. This figure shows the major veins of the human body. Moving on to another important topic, hepatic portal circulation. Hepatic, this term hepatic means related to liver. Portal means when there are two consecutive capillary networks before blood returns to the heart. So this particular system, hepatic portal circulation, they drain the blood from the GI tract and take the blood to the liver for screening. So the first capillary network is in the stomach, the intestine, in the other digestive organs, and then the nutrient laden blood, this blood also contains toxins, is taken by hepatic portal vein into the liver. In the liver cells, which are hepatocytes, they contain really strong metabolizing enzymes, and the empty spaces between them, called the hepatic sinusoids. This is where specialized macrophages, your soldiers are there. The macrophages are known as Kupffer cells here. And these macrophages, they remove any pathogens, toxins which have managed to go past your GI defenses. And from there, the hepatic vein takes it back to venous circulation. This figure shows a simplified illustration of the hepatic portal system. So arterial blood is flowing, and you can see the first capillary bed in the stomach and the intestine. This is where the nutrients and the toxins are absorbed in the blood. Then the hepatic portal vein takes this blood into the second capillary network present inside the liver. In the liver, the nutrients and the toxins go into the hepatocytes and the hepatic sinusoids, where there are macrophages. So these toxins and pathogens are screened for, and finally the safe blood is taken by the hepatic vein, and the hepatic vein drains into the inferior vena cava. The blood vessels that are bringing the nutrient and toxin rich blood into the hepatic portal vein include the superior mesenteric vein, the inferior mesenteric vein, the splenic vein with the pancreatic branches, and so on. Pulse is defined as the pressure wave of blood, and you can feel the pulse or monitor the pulse at some specific pressure points which are present in the arteries. The pulse is usually about 70 to 76 beats per minute when the body is at rest. This figure shows you the location of the various pulse or pressure points in the body. Blood pressure. Whenever you visit the doctor, the medical assistant takes your blood pressure. There are two values that are written. There is the systolic value, which is the blood pressure at ventricular contraction, and the diastolic pressure, that means when the pressure when the ventricles are in late diastole. We usually write the systolic pressure first, followed by the diastolic pressure. An average blood pressure for a healthy human being is around 120 over 80 millimeters of mercury. Mercury is denoted by Hg. And in general, the pressure in blood decreases, blood vessels decreases as the distance of that blood vessel increases from the heart. This figure depicts how the blood pressure is changing as the distance of the blood vessel from the heart is increasing. On your x-axis, it starts with the aorta, which is closest to the heart. The aorta branches into the arteries. Arteries become arterioles. Arterioles branch out into the capillary networks. Then capillaries merge to form venules. Venules would merge to form veins, and the veins would form the large veins, the superior and the inferior vena cava. That means the pressure inside the aorta is highest. You can see it on the y-axis. It is highest, both systolic and diastolic pressure, because this blood vessel is very close to the heart. As the distance of the blood vessel is increasing from the heart, the pressure goes down. You can see the pressure is lowest in the vena cava. Blood pressure is measured by an inflatable cuff, and that is known as sphygmomanometer, and it is usually measured by listening to specific sounds which are called Korotkov sounds, and the unit of blood pressure is in millimeters of mercury, or mmHg. So the process by which blood pressure is measured is as follows. The inflatable cuff or the sphygmomanometer is wrapped around the arm, about a little bit superior to the elbow, and then it is inflated to about 200 or 300 millimeters of mercury. This puts a lot of pressure on your arm, and it compresses the brachial artery and blocks the blood flow. A stethoscope is placed, in the cuff, and then the pressure is slowly released or vented from the cuff. As the pressure is going down, when the pressure becomes less than the pressure in the brachial artery, blood starts trickling slowly, it starts flowing through the artery. This flow is turbulent, that means disturbed. And whenever there's a disturbed flow, because the artery is still compressed, it's not completely open, it produces a sound which is known as Korotkov sound, and it is heard by the stethoscope. This audible sound, the Korotkov sound, as soon as it is heard, the first time the sound is heard, it is recorded as your systolic pressure. As more pressure is released, there is the blood flow in the brachial artery, it becomes less and less turbulent because the lumen opens up more and more. And at one point of time, the sound just totally fades because now the pressure has become completely smooth or laminar. So there is no blockage in the artery, and at that point there is no sound that is heard. So when the sound totally stops, that is known as the, or that is recorded as the diastolic pressure of the artery. Multiple factors affect your blood pressure. It is affected by age. It is also affected by what time of the day you're taking. You can take your blood pressure in the morning and in the evening and you will see some difference. It also depends on your body position. If you're standing, if you're lying down, or if you're sitting. Your emotional state, if you're in, in a state of stress, that also has an effect on the blood pressure. Neural factors such as your sympathetic division of the autonomic nervous system, it regulates blood pressure. Renal factors, that means factors of the kidney and the renal system, they also control blood pressure by controlling or changing the blood volume. Temperature, heat has a vasodilating effect, that means it dilates the peripheral blood vessels, while cold has the opposite, vasoconstricting effect. Chemicals such as nicotine, they can also increase your heart rate, some can decrease. This is a summary of the factors controlling blood pressure. So whenever homeostasis is disturbed, that means let's assume that the blood pressure and the volume are decreasing, there would be some long-term and some short-term effects. The long-term effects would be caused by hormonal responses such as antidiuretic hormone, aldosterone, or erythropoietin. These hormones would be released, which would increase the blood volume and which in turn would increase the blood pressure. For the short-term response, it would be response by the nervous system. The nervous system would stimulate the baroreceptors, that means receptors for blood pressure, and the chemoreceptors that detect changes in the chemicals. They would stimulate some cardiovascular centers, and these can lead to vasoconstriction of the peripheral blood vessels, and this would ultimately increase your cardiac output. Blood pressure shows variations. Normal blood pressure is considered 140 to 110 millimeters of mercury, that is systolic pressure, while 80 to 75 is diastolic. When it is hypotension, that means low blood pressure, the low systolic is below 110 millimeters of mercury. Hypertension, which is high blood pressure, where the systolic pressure becomes high, it is above 140 millimeters of mercury. Both are considered abnormal. They are associated with some kind of problem in the body. All the exchange that has to occur between blood and tissue occurs only at the level of capillaries. Remember, no exchange can occur anywhere else. It cannot occur in the arteries, arterioles, veins, or venules. It has to occur in the capillaries. So the oxygen and nutrients would leave the blood. They go from the blood vessels into the tissues, and carbon dioxide and waste products would come back from the tissues into the blood. Different mechanisms facilitate this capillary exchange. There could be direct diffusion that is occurring across the membrane of the capillary. There could be active transport, vesicular transport, such as endocytosis or exocytosis. Some capillaries would have gaps in their wall, in the cells of the wall. These are known as intercellular clefts. The plasma membranes do not have tight junctions. Instead, they have gap junctions. There could be pores which are known as fenestrations. This figure illustrates the different mechanisms of capillary exchange.